Airway management is a critical competency in emergency and acute care because failure to recognize and manage airway obstruction can rapidly lead to hypoxia and death. Therefore, students must not only understand the theoretical principles of airway anatomy and methods of airway assessment, but also develop practical skills. The flipped classroom is a learner-centered teaching strategy in which students review core theoretical concepts before class through videos, readings, or online modules, while classroom time is used for active learning, discussion. The flipped classroom allows students to acquire foundational knowledge before the face-to-face session. Pre-class materials help students understand key concepts such as airway anatomy, signs of airway compromise, and use of airway adjuncts. As a result, classroom time can be devoted to higher-order learning activities including case discussions and hands-on practice with airway mannequin. This approach promotes active learning and clinical reasoning, as students apply their pre-learned knowledge to practical situations such as recognizing airway obstruction, selecting appropriate airway maneuvers. Furthermore, it encourages self-directed learning, collaboration, engagement, which are essential competencies in medical education. Students participate in small group discussions, case-based scenarios, and simulation exercises involving patients with suspected airway obstruction. They practice airway assessment, perform basic airway maneuvers, and insert airway adjuncts using mannequins under instructor supervision. Faculty provide demonstrations, guide practice, and clarify concept. Assessment is conducted using both formative and summative methods. Pre-class quizzes used to evaluate students' understanding of the preparatory materials. During the session, instructors assess students' performance through observation of practical skills, participation in case discussions, and peer feedback. Structured checklists can be used to evaluate competence in airway assessment and airway maneuver techniques. Immediate feedback helps students improve their performance and reinforces correct clinical practices. Student involvement is a key component of the flipped classroom, as learners actively participate in both the preparation and application phases of learning. Flipped classroom approach has a positive impact as it improves understanding of key concepts because students review learning materials before the class, allowing them to learn at their own pace and revisit complex topics. Second, the approach enhances practical skill development. Third, the flipped classroom promotes active participation and engagement. Fourth, the method builds confidence and teamwork skills. Overall, this approach promotes active participation, skill acquisition, and continuous feedback, ensuring that students develop the competence and confidence required to manage airway obstruction effectively in emergency situations.